So I'm from Great Falls, Montana. It's a medium-sized town in Montana. Great Falls is sort of on the border of the mountains and the plains. In Montana, like the geography there, about 2/3 of the state is plains, and then the other third is the mountains on the western part of the state. So Great Falls sort of straddles the border there. My grandparents got me into golfing pretty early. All my grandparents, mom and dad's side, golfed, so we did that. I'm still not very good at it, but I try my best. I grew up in Montana, went to medical school in Colorado, which was sort of a natural progression for me. It was a very similar climate, and Montana not having a medical school, that was just a natural place to go. Residency took me a little bit farther south into Memphis at Campbell Clinic. Then we went up to Philadelphia for the end of my training. That was, it was a lot of fun and very interesting, but it was a really big city life that we weren't necessarily used to. United Hospital Center is in a great location. The first thing that really jumped out to my wife and I were the schools in the Bridgeport area. We just wanted our girls to grow up in a nice, safe environment where they could thrive, so that was a huge draw for us. The United Orthopaedic and Spine Center is a great place for me to work right now because it brings a lot of different specialties under one roof. It brings neurosurgery, physiatry, sports medicine, and physical therapy in the same building, and allows us to collaborate on patient care in a lot of different ways. So I treat all variety of shoulder and elbow disorders. I see a lot of different athletic injuries, AC separations, shoulder dislocations, labral tears. I also see rotator cuff tears, people with arthritis, and there's a lot of different variations in those sorts of injuries. Around the elbow, there's also a wide variety of different injuries. You see tennis elbow or golfer's elbow. And for those patients that are having shoulder or elbow surgery, I think it's important to know that that's not really our first line of treatment for a number of different disorders. It's something that we think about hard when we're recommending surgery to a patient. It's not something that that's usually the first thing that we recommend. One thing that drives most people to doing surgery is the ability to identify and fix a problem. And so for me, what really drew me to shoulder and elbow surgery, one, was the ability to make people better. I see a lot of miserable people that walk in with shoulders or elbows that aren't working right, and that impacts your life significantly. You can't do the things you want to do, and you're in pain almost every day. I also treat ulnar collateral ligament injuries, or what most people know as like Tommy John's injuries. It's an injury to the inside of the elbow that's common in gymnasts, various different athletes, cheerleaders, overhead athletes, people that throw, and it's an injury to the inside of the elbow that really hinders people from using that. And so the advent of Tommy John surgery allows us to get people back to their usually better than pre-injury level of performance after surgery.